So I think we've all heard about the new vaccine coming out and how it supposedly makes people infertile. So I thought I'd do a little bit of snooping, and I think I found the article where all those fears sort of originated from. It is pretty well sourced. There's well accredited people making these claims, and we'll get into that here after a few disclaimers. Number one being that the FDA as an organization itself, I think, should be done away with. All this crazy regulatory shit that we've done in the US, particularly with respect to healthcare, causes mountains of problems. I mean, it takes, what, 10 years and $1 billion to get a drug approved via the FDA under traditional circumstances. So there's a lot to be said for the amount of damage and death that the FDA by itself has caused since its existence. Unironically, in this case, in the wake of thalidomide, but I guess you can check that out if you want, you know. And it's as much of a fact as anything else that these companies have been basically shielded from any kind of immunity. I mean, how great is that, right? Very, very convenient. Or shielded from any kind of liability. I think I said immunity there. You know, so there's no incentive to make sure it's safe. There's every single incentive to make sure they get it first to the market. And as we're going to see, the short-term nature of these studies haven't really been long enough to flush out any of the long-term consequences. And when we're talking about a disease here that literally has, you know, a 1% chance of killing you, if that, again, unless you fall into certain demographics, it's really like, why would you take that sort of risk for something that you probably won't even know you have without being tested? So it's like, I don't know, dude. And vaccines otherwise, like the old ones that have been tried and true, they're absolutely amazing inventions. They're incredible technologies. I mean, there's been entire diseases that were wiped off the face of the planet. And it's, I think, pretty cool that these days we're so far removed from viewing bacteria and viruses as monsters that even before this COVID thing, there were, you know, reams of people who were against all your typical, you know, your MMR vaccines, tetanus, all that crap. I have all those, I'm fine, and sure as shit ain't gonna get any of those horrible diseases that, again, it's great that they were eliminated. And so really, vaccines are great. They're a fabulous medical technology, but when you zoom out and look at everything that's gone on with COVID from like a holistic standpoint, I guess, I mean, you probably want to stay far and away from that shit. So not to mention, like I said earlier, you should be able to put whatever you want in your body, something that the US government, along with the FDA, clearly prohibits with a variety of substances. And, you know, more power to you if you want to take this vaccine, but no one who doesn't want to take it should be forced essentially to choose between bodily autonomy and, let's say, going to the grocery store, because we all know that from like a legal standpoint, it would be much easier to, I guess, kind of fight to the degree that they would even have to, because US courts have found again and again that mandatory vaccines are okay. But it would be a much bigger deal to say, oh, well, the government's trying to mandate a vaccine. We can kind of get rid of that in one fell swoop. Well, if Ticketmaster and Walmart and Kroger and all the airlines, they all get behind each other, you know, that's a lot more lawsuits, a lot more time, a lot more people that are going to get the vaccine. So these two doctors, Dr. Michael Yeadon and Dr. Wolfgang Wodarg, filed a thing with the European Medical Agency to suspend all SARS-CoV-2 vaccine studies, citing a poorly designed study. And the reason that they're saying that is because these PCR tests that they use to determine whether or not you have COVID, you know, where they shove the thing in your nose and, you know, you got to wear a mask to prevent yourself from spreading it, but the, you know, the particles are so difficult that we got to shove something all the way basically into the middle of your fucking skull to get a sample of it. It's pretty retarded. But you see, the lunacy doesn't stop there, because these PCR tests, right, I'm going to summarize it very briefly, but the way that they work is they shove it in your nose, they put it in a centrifuge, and they kind of spin it around to try and detect the level of viruses. Again, I know this is very, very curt, and you know, these are how the tests work. Well, the thing of it is, you can get any PCR test to say that it's positive. So if you run it through enough cycles, then I mean, you could take some tap water and it would test positive for SARS-CoV-2. So that, with that being the case with these PCR tests that they use to determine whether or not you have COVID, it kind of makes it impossible to structure a sound study. So it doesn't stop there. You know, with other research that was done with trying to find coronavirus vaccines, which is something that's been going on for a long time. Imagine if you didn't have to catch the common cold anymore. Oh, which is another thing about these PCR tests. If you have a cold, it may indicate that you have SARS-CoV-2. So yeah, really convenient, right? So that's why they say more testing, more cases, right? Weird how that works like that. So now here's where we're going to get a little techie. They're saying that the formation of non-neutralizing antibodies can lead to exaggerated immune response when confronted with the virus in the real world. It's a phenomenon called antibody-dependent amplification, which has been observed in cats. So they give, you know, Schnookums the kitty cat the little jabby McJab, and oh, everything's fine, do, but then Schnookums comes across the actual COVID virus, and they fucking die. I mean, I know we're not cats, but generally, like if you're doing this in mice or something, oh, the vaccine, it fucking killed them. Well, we might want to slow things down, take a step back. So you see, these fears are not totally unfounded when it comes to what's going on truly with this vaccine and everything beyond that, just with COVID itself. So the vaccine is expected to produce antibodies against the spike proteins of SARS-CoV-2, which is nice. However, in doing so, it's hypothesized that they could cause an issue with these syncytin homologous proteins. I'd probably slaughter the pronunciation of that, but apparently those are critical not only in placenta development, but also in sperm development. So there is grounds to wonder whether or not once you get this vaccine, are you going to be able to produce motile quality sperm? Are you going to be able to, you know, produce a placenta? And if you can't produce a placenta, then you can't have a baby, and now you're never going to have kids again. So it sucks. You know, there is something that literally has as much likelihood as killing you as if you were going to die in a car crash and you took a vaccine which you didn't even need and now you're infertile. So these are the kind of questions out there hanging out that everybody, particularly the mainstream media, is just kind of, yeah, well, fuck it, you know, we got a vaccine, you know, because they pump all this crap with the mainstream media, get everybody all scared, and so without an answer that kind of makes sense from the mainstream as well, then the fear will never go away. It's almost like trying to, I don't know, I guess you could compare it to breaking somebody of their hypnosis. Like there has to be that keyword that's said, otherwise they kind of stay like that. Well, that's what goes on when half your population is hopelessly retarded and addicted to the narrative peddled by, you know, pretty much private companies. So take that for what you will. The mRNA vaccines themselves contain polyethylene glycol, which I guess a lot of people have allergic reactions to. Sometimes they're quite severe. I think I forgot to mention up here as well that, you know, mentioning the mRNA technology, the really cool part about this Operation Warp Speed and everything that they're doing is that this new delivery mechanism is pretty cool. Like if they can hammer this out, it's going to open up a lot of possibilities a lot more quickly than otherwise would have been the case. I think when it comes to particular things like modifying your genome to, say, reduce aging, prevent this sort of disease, prevent that, maybe make your baby's IQ higher, you know, that's things in that vein. This is going to help. There's going to be a lot of data on that sort of thing, which is a cool, you know, definitely a white pill, but, you know, Operation Warp Speed and others like it, you know, just by their very nature have made it impossible to have the kind of long-term study that a lot of people would like to see before they get a vaccine, again, for something that has a 99% chance of not killing them if they even get it. So that's kind of where all this stuff is coming from. There's a lot of questions surrounding the vaccine, along with the whole thing that's going on with COVID in general. So I think to see people so, you know, offhandedly dismissed for having concerns about it is a little ridiculous. So keep in mind, again, if you want to get the vaccine, that's fine. That's fine. Hopefully nothing happens to you, but I ain't gonna touch that shit with a 10-foot pole.